Hello my friends, we will talk about the spine anatomy with you, Yusuf Arafa, physical therapy student at Heliopolis University. So, we'll talk about the spine anatomy regarding spinal unit, intervertebral disc, ligaments, spinal cord, and lumbar area and cervical area, and the muscles involved in the trunk. Okay, what is the spinal unit? The spinal unit is a two vertebrae and one intervertebral disc, including two facet joints. Also, there is the pedicle of the vertebrae, vertebral body, and the lamina, and the spinous process, transverse process, and the articular facet, which form the facet joint. Okay, let's take a look on the landmarks of this bone. There is the inferior articular facet. This is the lamina articular part, and the transverse process, spinous process, and the superior articular process. This is the lumbar vertebrae. It is a typical vertebrae of the human body. Okay, let's talk about the intervertebral disc. The intervertebral disc is a fibrocartilage, which is containing a nucleus pulposus in the center and annulus fibrosus on the outside. It has a viscoelastic behavior, which is has a stress relaxation, and when we do flexion, the nucleus pulposus displaces posteriorly. Okay, let's talk about the ligaments of the spine. Okay, what is the ligament of the spine? There are 6 ligaments of the spine. One, the ligamentum flavum. The ligamentum flavum, also called yellow ligament, it attaches with the anterior surface of one lamina and the posterior surface of the lamina below it. So it limits and softening the end range of intervertebral flexion. Also, there is supraspinous ligament and intraspinous ligament. Their attachments between the adjacent spinous process from C7 to the sacrum. Its function, it limits flexion. The ligamentum nuchae in the cervical region and the cranial region limits is the extension of the supraspinous ligament. Provide midline stretch from muscle attachment to support the head. Transverse ligament between adjacent transverse process limits contralateral flexion and the forward deflection. And also there is the anterior longitudinal and the posterior longitudinal ligament. The anterior longitudinal attached between the basilar part of the occipital bone and the entire length of the anterior surface body of the vertebral bodies, including the sacrum. The function of the anterior longitudinal ligament, it limits the flexion or excessive lordosis in cervical and lumbar. It reinforces the anterior sides of the intervertebral disc. Best developed in the lumbar spine, about twice the tensile strength as the posterior longitudinal ligament. This tells us why always the disc bulge happens posteriorly, because the posterior longitudinal ligament is less tensile than the anterior longitudinal ligament. Also, there is another reasons for that, but also there is one of the reasons. Posterior longitudinal ligament throughout the length of the posterior surface of all vertebral bodies between the axis of C2 and the sacrum. It is the attachments. The function limits flexion, reinforces the posterior sides of intervertebral disc, lies within the vertebral canal just anterior to the spinal cord. So if it have some like inflammation, the posterior longitudinal ligament or ligamentum flavum, we will have some stenosis in the vertebral canal. Also, the capsule of the apophyseal joint, the facet joint, margin, it attaches with the margin of each apophyseal joint. It strengthens the apophyseal joint, loose in the near neutral automatic position, but come taut at the extreme of all other positions. Okay, let's take a look here. This is the vertebral spinal unit, and this is the ligaments. Also, we'll talk about the spinal cord. Here, the pia mater and the dura mater and the arachnoid mater. Also, this is the dura. Also, the dura is the most superficial and is the most important to protect the spine. All of them protect the spine. The arachnoid have subarachnoid space between it, which contain CFS or cerebrospinal fluid. Also, the spinal cord ends at has a spinal segment under the vertebral body. The spinal cord ends at L1 and continues as a coda equina. So, if there is a lesion from C2 until L1, there is an upper motor neuron lesion, while any impairment from L2 until S4, it's a lower motor neuron lesion. Let's take a look on the lumbar region and its vertebrae. It's more typical vertebrae, but we have some remarks here that when we go more caudally or more inferior, the vertebral body and the vertebrae become more thickened because the weight bearing become more after we go inferiorly. So the lumbar region is a 3-joint complex. There is a 2 facet joint and 1 intervertebral joint between them. Also, we'll take a look about the cervical region. The cervical region has 3 typical vertebrae, which they are different from the lumbar vertebrae because the spinous process is not as big as the lumbar vertebrae, but although C7 is like the dorsal vertebrae. We have the atlas and the axis and C7. They are atypical vertebrae. If you see here, the atlas C1 have a transverse foramen and have no vertebral body and have no spinous process, while C2 also have no vertebral body. There is a difference in the cervical vertebrae from other vertebrae, which it has uncinate process, which form the ancovertebral joint or the joint of Floschka. And we have 2 uncinate process, so we will have 2 joint of Floschka. So the cervical region is 5-joint complex. Also, the intervertebral joint has an axial loading from 40 to 50%, while the 2 facet joint and the 2 joint of Floschka have also 50% of the loading. Why is that very important in the cervical region? Because the cervical region is very important. It has all the blood supply translated to the brain, or 2/3 of the blood supply to the brain is translated through the cervical region. It's very important to be careful with this region when you apply manual therapy or any modality of treatment. So the cervical spine, its height is 7 centimeter. It has 16 nerve root, 34 joint and 14 facet joint, 12 joint flosca, and 7 intervertebral joint, and atlantoaxial and 2 atlanto-occipital joint. Also, the basovertebral artery supply third blood supply of the brain and the spinal cord. So let's take a look on the movement of the spine. There is the flexion and the extension. There is the rotation, and that is the side bending. Okay, let's take a look about the muscles posterior to the trunk. The trapezius, latissimus dorsi, rhomboids, levatoroscapulae, and serratus anterior. We know what muscles is acting in this and how its action. And let's take a look at what we don't know: the serratus posterior superior and serratus posterior inferior. They help in inspiration. So the serratus posterior inferior helps in inspiration, while the serratus superior posterior helps in inspiration. There is also a deep layer, the erectorospinae group, spinalis, longissimus, and the ilicostalis. It's very hard to have video of all the erectorospinae group because it's very small, and these groups are deep layers. So the transversospinal group are semispinalis muscles, multifidus, and rotators. And we have short segmental group, interspinalis muscles, intertransversalis muscles. We have also muscles of the anterior lateral trunk: rectus abdominis, obliquus internus abdominis, obliquus externus abdominis, and transverse abdominis. This is the image of the rectus abdominis, external oblique, and transverse abdominis here. We have the linea albia, which is the common origin from them. We have some action for the external oblique. See here, we have some posterior pelvic tilting. Let's take a look at some images. This is the external oblique. This is the action of the anterior wall muscles. The main action is flexion. If they act unilaterally, they will do side bending. This is the origin and the insertion, and there is some photos for the erectorospinae muscles. Like there, it's hard to have them isolated in a video, so we get some photo to demonstrate the muscles. There is the ilicostalis, longissimus, spinalis. Spinalis, from its name, it's originated from the spinous process. Also, we have the deep muscles, transversospinalis. Here we can have multifidus, rotator longi. There is a video right here, what I found on the internet, demonstrating the electrospinae and all the posterior group of the trunk muscles. They act in this video, and this extension they do. Let's watch the video again. Thank you for watching this video, and I hope it's helpful for you demonstrating the spine anatomy in a helpful way. Thank you very much.